Okay, so you're back with us for another deep dive. And today we're tackling something that's really, fundamental for anyone who's looking at the UPSC exams, and that's India's nutrition challenge.
Yeah.
We see this topic cropping up again and again, whether we're talking about social justice or, the economy or healthcare or anything really. It's always there lurking in the background. And, there's a good chance it could even pop up on the prelims as well.
Oh, absolutely.
So you really need to get a handle on this. So we've been digging through the Hindus, mostly, to get some insights, and we want to share those insights with you today.
Yeah, and for anyone preparing for the UPSC, I think it's really important to understand that this goes beyond just like, are we producing enough food? India's nutrition challenge is so much more than that. It's tied to so many other things like cultural practices and, even gender dynamics within households.
Right.
And, we can't ignore the fact that there's a growing number of diet-related diseases that are impacting a lot of people in India.
Yeah, so what we want to do today is kind of break this down into three parts, right?
Okay.
So first we'll look back and trace how India's nutritional security programs have evolved over time, and then we'll try to understand why this challenge is so persistent. Like, despite all these efforts, why is it still such a big issue?
Right.
And then finally, we'll explore some potential solutions and even look at some success stories from within India itself.
Yeah.
Just to see what's working and what we can learn from those experiences.
Right.
So to kick things off, let's rewind back to the post-independence era. Where did it all begin?
Well, in those early decades after independence, so we're talking, from the 1950s up to the 1970s, the biggest concern was really just making sure there was enough food in the country. Like India was facing serious shortages, right?
Right. Yeah. I mean, there was a very real fear of famine at that point.
Exactly. So the government was laser focused on boosting agricultural production just to ensure that there were enough staple grains to go around. The emphasis was very much on quantity.
So during that initial phase, nutrition-specific policies were kind of limited, right?
Yeah, I mean, the approach was really about tackling hunger as a whole.
Right.
And, the few nutrition initiatives that did exist were mostly those targeted feeding programs aimed at the most vulnerable, like young children and pregnant or lactating mothers.
Yeah, which makes sense. I mean, those are the groups that are most at risk.
Right. And this is where we see the public distribution system, the PDS coming into play.
Yeah, PDS, that's a big one.
It actually has its roots in World War II, but it was massively expanded after 1947 with the idea of offering subsidized staple grains to combat that widespread food insecurity.
And then came the Integrated Child Development Services in 1975, the ICDS. That seems like it was a much more direct and comprehensive approach to early intervention.
Yeah, it was a significant step forward for sure. The ICDS tried to be more holistic in its approach and offered not just supplementary nutrition, but also things like immunization and preschool education for children under 6, and of course support for pregnant and lactating mothers.
That's a pretty broad range of services all in one program.
Exactly. And then in the 1970s, we also had the Balwadi Nutrition Program, which specifically focused on giving nutritional supplements to preschool kids in rural areas. So you can see there was a gradual shift in thinking, moving beyond simply providing food to recognizing that tackling malnutrition required a more integrated approach with multiple services.
So then comes the Green Revolution, right? And India achieves food self-sufficiency.
Yep.
So how does the thinking around nutrition change then?
Well, with the Green Revolution taking off in the 60s and 70s, and India achieving self-sufficiency when it came to cereal production, the focus started to broaden. In the 80s and 90s, there was this growing understanding that just having enough calories available didn't mean people were automatically well-nourished.
Right, just because you have enough doesn't mean it's the right kind of food.
Exactly. So we start to see this shift from a singular focus on food availability to this broader idea of social welfare and this recognition of the importance of dietary quality.
Okay, so during this period, nutrition programs start getting more integrated with existing health and education systems, right?
Exactly. So you see the midday meal scheme being formalized in 1995, and then later getting that Supreme Court directive in 2001 providing cooked meals to kids in school was aimed at improving both their nutrition and boosting school enrollment.
Makes sense. I mean, a good meal can be a big incentive to go to school.
Oh, for sure. And then you have the National Nutrition Policy in 1993, which was a big deal because it advocated for this multi-sectoral approach, recognizing the interconnectedness of agriculture, health, and food distribution when it comes to achieving nutritional security. And we can't forget the Universal Immunization Program starting in 1985, which played a huge role in addressing nutrient deficiencies that are often linked to infections.
So the focus is expanding beyond just getting enough food to considering the quality of that food and the broader social factors that influence nutrition.
Right.
So what's the next big shift in thinking?
Well, in the 2000s, you see this really important change in perspective. Nutrition support moves from being seen as just a welfare thing to being recognized as a fundamental right.
That's a big shift.
It is, and there's also this growing awareness of hidden hunger, these micronutrient deficiencies that can have serious long-term health consequences, even if someone's getting enough calories.
Right, it's not just about being full, it's about getting the right nutrients.
Exactly. So this shift towards a rights-based approach to food and nutrition security, along with a better understanding of the role of micronutrients, that's a key takeaway from this period.
And this rights-based approach led to some pretty significant changes in legislation, didn't it?
Oh, absolutely. The National Food Security Act, or NFSA, in 2013, that was a landmark piece of legislation. It legally entitled a big chunk of the population, up to 75% in rural areas and 50% in urban areas, to subsidize food through the PDS.
So that really solidified the government's commitment to ensuring access to food as a right.
Yeah.
And we also see a more direct and large-scale effort to tackle those micronutrient deficiencies.
Right. You have programs like the Iron and Folic Acid Supplementation Program, also launched in 2013, which aim to combat the widespread issue of anemia, especially among women and children.
And that's still a major problem today, isn't it?
It is, and then you have an increased emphasis on food fortification programs, distributing fortified rice, wheat, and milk to try to address hidden hunger on a large scale.
So we're adding those essential nutrients directly into the food that people are already eating.
Exactly. And then in 2018, we saw the launch of Piochon Apine, specifically aiming to improve the nutritional status of young children. And for those of you prepping for the UPSC, Piochon stands for Prime Minister's overarching scheme for holistic nutrition.
Right. So always good to know what those acronyms stand for.
Yes.
Okay, so now we're in the current era, the 2020s, and beyond. What would you say is the defining characteristic of this latest phase in addressing nutritional security?
I'd say it's all about greater integration and a life cycle approach. There's this growing understanding that nutrition isn't a standalone issue.
Right, it's connected to everything else.
Exactly. It's tied to healthcare, agriculture, even individual behavior. The focus is becoming more holistic, looking beyond just calorie intake to consider the quality, the affordability, the awareness around food, and all of this across all stages of life.
So it's not just about kids anymore, it's about everyone.
Right, and we're seeing new initiatives that reflect this more integrated thinking.
Look, what kind of initiative?
Well, you have Piochon 2.0 launched in 2022, which merged previous schemes like the ICDS, the midday meal program, and the original Piochon Avion to create this more streamlined and comprehensive life cycle approach.
So sort of bringing everything under one umbrella.
Exactly, and the big push for millets, especially during the International Year of Millets in 2023, that shows the focus on nutrient-rich and climate-resilient crops.
Right, millets are having a bit of a moment.
They are, and they're being encouraged in programs like the PDS and midday meals. Then you have the One Nation, One Ration Card initiative, or ONORC, which is crucial for ensuring that migrant workers can access subsidized food no matter where they are.
Right, that's a big one for ensuring food security for a very mobile population.
It is, and the strengthening of health and wellness centers under Ayushman Bharat to include nutrition counseling and the prevention of non-communicable diseases that really highlights the integration of nutrition into primary health care.
So it seems like there's been a lot of progress in terms of how India approaches nutritional security. But despite all these programs and policy changes, the data still shows that this is a very real and persistent challenge. Why is that?
That's a really key question. And, despite decades of effort, India still has alarmingly high rates of child malnutrition and anemia. The National Family Health Survey 5 data from 2019-21 shows that about 36% of children under 5 are stunted, and a whopping 57% of women between 15 and 49 are anemic. And if you look at global indicators like the Global Hunger Index in 2023, India ranked 111 out of 125 countries, which is pretty concerning.
Yeah, that's not a good ranking.
No, it's not. So what this tells us is that even though there's been significant progress on food security, achieving nutritional security requires tackling deeper, more systemic issues, things like poverty, lack of dietary diversity, and poor maternal health. Those all have a huge impact on early childhood nutrition.
And it's not just a problem of undernutrition, is it? We're also seeing this rise in the double burden of malnutrition.
Exactly. Alongside undernutrition, you're seeing an increase in overweight and obesity, as well as diet-related non-communicable diseases like diabetes and hypertension. And this is largely driven by urbanization and changing lifestyles. People are eating more processed foods, more sugary drinks, and living more sedentary lives. And the economic survey of 2023-24 highlighted this trend.
So it's like we've solved the problem of not having enough food for many, but now we're dealing with the problem of having the wrong kind of food, too much of it, and not enough activity.
That's a good way to put it. And the problem is that healthy food is often just too expensive for a big part of the population, while those less nutritious options are cheap and readily available. So it's a bit of a vicious cycle. And the numbers are worrying. Almost a quarter of Indians are now either overweight or obese, and diabetes is affecting an estimated 77 million adults, with another 25 million in the pre-diabetic stage.
You also mentioned gender and social disparities playing a big role in nutritional access. Can you talk a bit more about that?
Sure. So in India, who gets to eat what and how much within a household that's often dictated by deeply ingrained gender discrimination, caste hierarchies, and other social inequalities. Women, especially in rural areas, often eat last and least, and that contributes significantly to those widespread micronutrient deficiencies now. While many government programs quite rightly target pregnant women, there's often not enough focus on the specific needs of adolescent girls and elderly women.
So it's about recognizing that women have different nutritional needs at different stages of their lives.
Exactly. And sadly, the NFHS 5 data didn't show much improvement in the nutritional status of women, which just highlights how persistent these societal barriers are.
And then there's the whole issue of climate change, which is already having a big impact on agriculture and food security.
Yeah, climate change is a major disruptor when it comes to nutrition. Things like extreme weather events, heat waves, erratic monsoons, droughts, these are all affecting crop yields, pushing food prices up and reducing dietary diversity, especially for the most vulnerable parts of the population.
So climate change is making existing inequalities even worse.
It is. We're already seeing the impact of climate-induced food insecurity in many regions. For example, India experienced its warmest February in 124 years, which affected wheat yields. And there are projections suggesting a 6–10% decline in both rice and wheat production due to climate change. So that obviously has huge implications for both food availability and nutritional security.
So even if we have good programs on paper, sometimes the actual implementation on the ground can be a problem, right?
Yeah, that's a critical point to consider schemes like the midday meal program Anganwadi services under the ICDS and those food fortification initiatives. They often suffer from things like leakages, inefficiencies, and difficulties in reaching all the intended beneficiaries.
So it's not just about having a program, it's about making sure it actually works.
Exactly. And for example, a lot of Anganwadi centers might not have properly trained staff, and the quality of take-home rations can be inconsistent. And then you have the urban poor and migrant workers who often struggle to access those formal safety nets.
So they kind of fall through the cracks.
They do. There was a study that showed that a big chunk of the subsidized grains meant for the poor are lost due to leakages in the system. And there have been reports about the lack of basic amenities in many Anganwadi centers, which raises concerns about hygiene and their overall effectiveness.
So it sounds like there are issues with both access and quality.
Yeah.
And on top of all that, we have the economic realities.
Yeah.
Things like inequality and rising food prices, which must make these nutritional challenges even worse, especially for vulnerable households.
Oh, absolutely. Economic slowdowns, inflation disruptions in global supply chains, all of these things have made nutritious food more expensive, and that disproportionately affects low-income families. Now, initiatives like the PM Garb Kalyan Anna Yojana are great because they provide essential calories through free grain distribution, but they don't necessarily address those underlying micronutrient deficiencies.
So people might be getting enough to eat, but they're not getting the right nutrients.
Exactly. It's this phenomenon of being full but malnourished, and it's driven by what people can actually afford. And retail food inflation, especially for things like pulses and vegetables, has been really high. So it's a real struggle for a lot of families to put nutritious food on the table.
And you mentioned urban food deserts. Can you explain a bit more about what those look like in India?
Sure. So with rapid urbanization, you see these areas emerging where it's really hard to find affordable, nutritious food options like fresh fruits, vegetables, and whole grains. But what you do find in these areas are tons of fast food places and stores selling mostly processed and packaged foods that are often loaded with sugar, salt, and unhealthy fats.
So it's like a nutritional wasteland.
It kind of is. And low-income urban families, especially migrant workers and daily wage laborers, they really struggle to afford fresh produce, so they end up relying on those cheaper, calorie-dense, but nutritionally poor alternatives. And the scary thing is that a huge percentage of the food products available in India are packed with these unhealthy ingredients.
So even if you want to make healthy choices, it can be really hard to find those options.
Exactly. And this is contributing to both micronutrient deficiencies and those rising rates of obesity and related diseases in urban populations.
And finally, you talked about the importance of public awareness and the role of behavior change in all of this. How crucial are those factors?
They're absolutely fundamental. I mean, despite government efforts, overall awareness about nutrition is still pretty low, and food choices are often heavily influenced by cultural preferences, misinformation, and the constant marketing of those unhealthy food options. A lot of households prioritize taste, tradition, and affordability over nutritional value.
Yeah.
And unfortunately, school curriculums and public health campaigns don't always do a great job of teaching people about practical everyday nutrition, the kind of information that can actually lead to behavior change.
So it's not just about telling people to eat healthy, it's about giving them the knowledge and skills to actually do it.
Exactly. And studies have shown that a lot of Indians don't know enough about good vegetarian protein sources or healthy fats. So changing those long-standing food habits and boosting nutritional literacy, those are crucial but long-term challenges.
So it sounds like there's no one easy solution here. It's a really complex issue with a lot of interconnected challenges. So what kind of measures can India take to really improve nutritional security for all its citizens?
I think a multi-pronged approach is essential. We need to start by making those health and wellness centers into proper community-led nutrition resource centers where people can get personalized diet counseling, regular screenings for malnutrition and non-communicable diseases, and even help with developing culturally appropriate meal plans. Integrating Poshan 2.0 more effectively with the Ayushman Bharat framework can also extend those essential nutrition services beyond maternal and child health. And having dedicated, well-trained community nutrition officers at the local level, that would be a huge help in bridging the gap between healthcare facilities and community-level interventions.
So bringing those services closer to the people who need them.
Exactly. And then there's the midday meal scheme, which has the potential to really make a difference for kids. We should be focusing on using more regionally available nutrient-rich foods like millets, pulses, and locally sourced vegetables instead of relying so heavily on just rice and wheat.
So making those meals more diverse and nutritious.
Right. And involving local self-help groups and farmer-producer organizations in procuring and preparing meals that can ensure the food is fresh, diverse, and culturally appropriate. And aligning the midday meal scheme more closely with the millets mission would be a great way to promote those nutritionally superior grains.
What about food fortification?
Food fortification is a really cost-effective way to tackle hidden hunger, scaling up the mandatory fortification of staples like rice, wheat flour milk, and edible oils with those essential micronutrients that can make a big difference without requiring major changes in people's diets, and making sure the public distribution system is properly linked with the distribution of these fortified foods is key for reaching those low-income populations. But it's important to remember that food fortification shouldn't replace efforts to promote dietary diversification and access to naturally nutrient-rich foods.
So it's one tool in the toolbox, but not the only one.
Right, and then you have those urban food environments which need a different approach, using things like taxes on unhealthy foods, zoning laws to limit fast food outlets, and making those food labels clearer and easier to understand. All of that can help nudge people towards healthier choices. And then when it comes to climate change, we need to shift towards climate-smart agriculture that prioritizes nutrient-dense and climate-resilient crops like millets, pulses, and biofortified varieties, changing policies like the NFSA. To encourage the inclusion of millets in the PDS would also incentivize farmers to diversify their crops. And investing in things like watershed management, agroforestry, and regenerative farming practices can improve soil health, boost biodiversity, and ensure more stable and nutritious food production, even as the climate changes.
So it's about building resilience into the system.
Yeah. Exactly. And we also need to rethink our social protection schemes to go beyond just providing calories. The PDS could start offering more things like pulses, millets, and fortified dairy products, expanding the reach of the ICDS to specifically target the needs of adolescent girls and elderly women would also be a good move, and exploring the use of direct benefit transfers, or DBT, linked with nutrition support and education for groups like migrant workers and the urban poor that could give them more flexibility in their food choices while still making sure they're getting essential nutrients.
So it's about giving people more choices and more control.
Right. And then finally, when it comes to awareness and behavior change, we need a sustained, multi-pronged effort that's culturally sensitive. Things like a nationwide Right to Nutrition campaign integrated into schools, workplaces, and on social media that can raise awareness about balanced diets, food labels, and the risks of unhealthy eating involving local influencers, community leaders, and even faith-based organizations can help combat misinformation and promote healthy choices, especially in marginalized communities. And turning the Eat Right India movement into a year-round grassroots initiative can help build those healthy eating habits from a young age and create a supportive environment for everyone.
So it's about education, empowerment, and creating a culture of healthy eating.
Exactly. And, it's encouraging to see that some Indian states have already made good progress on this front.
Yeah, tell us about some of those success stories.
Well, Chhattisgarh, for example, has seen a noticeable drop in stunting rates because they took this comprehensive multi-sectoral approach focusing on improving access to healthcare, sanitation, and household assets. Strong political will and community mobilization were key factors in their success. And Gujarat has also done well in reducing stunting by creating a supportive policy environment and strengthening those maternal and child health interventions. And of course, progress in women's education and rural development also played a role. Odisha has shown consistent improvement through strong political commitment and sustained policy support. They've been good at leveraging partnerships and financial resources to scale up those key nutrition programs, although they still have some challenges. And then you have Tamil Nadu, which has had this long-term vision for nutrition with sustained investments in social welfare, public health, and gender equality over many decades. And that's led to some really impressive and lasting reductions in undernutrition. They have always had a strong focus on women's welfare and child development. So all of these examples show that strong political commitment, effective coordination between different sectors, evidence-based policy making, and active community engagement, those are all crucial for making real and lasting progress on nutritional security.
So we've covered a lot of ground today. We've looked at how India's approach to nutrition has evolved over time, from that initial focus on tackling food scarcity to this broader understanding of nutritional well-being. We've also examined those persistent challenges that remain, things like child malnutrition, the double burden of malnutrition, gender and social disparities, the impact of climate change and the need for effective implementation and public awareness. And finally, we've explored some potential solutions focusing on strengthening local systems, addressing inequalities, using climate-smart agriculture, and learning from those states that have already made good progress.
Right. And what's really interesting to think about is the tension between individual responsibility and systemic change. On one hand, you have the individual's choice to eat healthy, but on the other hand, you have those bigger systemic factors like the availability, the affordability, the accessibility of nutritious food. All of those things shape those choices and ultimately determine nutritional outcomes for a whole population.
So where do we focus our efforts? Do we try to change individual behavior or do we try to change the system?
That's a really good question and something to think about.
Yeah, a lot to unpack there. Well, we hope this deep dive has given you some food for thought, pun intended, and some valuable insights to help with your UPSC prep.
Yeah.
If you found this helpful, please do like and subscribe to our channel for more in-depth discussions. And feel free to leave a comment below with any questions or thoughts you might have. And just a reminder that most of the information we've shared today comes from the great reporting and analysis you can find in The Hindu.
Thanks for joining us.
See you next time.
Bye.